Hi everyone. In today's clip, I will talk a little bit about uterine fibroids. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So uterine fibroids, also called fibromyomas or leiomyomas or myomas, are non-cancerous sort of growth of the uterus that often appear during childbearing years. They are often asymptomatic and, contrary to popular belief, are not associated with increased risk of uterine cancer, but may affect fertility. It is unclear what leads to development of uterine fibroids, but hormones including estrogen, progesterone, and insulin-like growth factor appears to sort of promote their growth. Research suggests each tumor develops from an abnormal muscle cell in the uterus and multiplies rapidly when encountering the estrogen hormone, which promotes the tumor's growth. So ladies who have fibroids sometimes do not even experience any noticeable symptoms. Others with fibroids experience severe symptoms that interfere with their daily lives. Common symptoms to this can include things like heavy or prolonged periods, bleeding between periods, abdominal discomfort and or fullness, pelvic pain, lower back pain, bladder symptoms like frequent urination or difficulty emptying the bladder, bowel symptoms like constipation or excessive straining with bowel movements. It might bring about infertility, complications during pregnancy, pain during intercourse, and so on. So to diagnose uterine fibroids, the doctor or your doctor may order a pelvic ultrasound. This is a procedure during which a small instrument called a transducer is either inserted into the vagina or pressed over the abdomen to produce pictures of the internal organs using sound waves. The doctor can see the size, shape, and texture of the uterus and evaluate any growths. Next, there is magnetic resonance imaging or MRI. This is a form of imaging technology that provides highly detailed images of internal organs. These images help them sort of determine the exact location and characteristics of fibroids, and if needed, plan minimally invasive treatments. Then there is hysterosalpingography. This is a type of X-ray exam of the uterus and fallopian tubes. The doctor, of course, will use a special dye to more easily visualize these organs and determine if the fibroids have blocked the fallopian tubes. Then there is hysteroscopy. This is a visual exam of the cervix canal and the interior of the uterus using a viewing instrument inserted through the vagina. Then there's laparoscopy. During this test, the doctor will make a small cut or incision in the lower abdomen. Then a thin, flexible tube with a camera on the end of it will be inserted to look closely at the internal organs. Fibroids can grow as a single nodule, one growth, or in a cluster. Clusters of fibroids can range in size from 1 millimeter to more than 20 centimeters or 8 inches in diameter, or even larger. For comparison, fibroids can be as small as a seed, or it can be as large as a watermelon. So these growths can develop within the wall of the uterus, inside the main cavity of the uterus, or on the outer surface of it. So there are different types of uterine fibroids depending on where they're located and how they attach. So specific types of uterine fibroids include intramural fibroid. These fibroids are embedded into the muscular wall of the uterus, and this is the most common type. Then we have submucosal fibroids. these fibroids grow under the inner lining of the uterus. Then we have subserosal fibroids, and this type of fibroid grows under the lining of the outer surface of the uterus. They can become quite large and grow into the pelvis. Then we have pedunculated fibroids, and this is the least common type. These fibroids attach to the uterus with the stalk or stem, and they're often described as a mushroom-like being, sort of, because they have a stalk and then they have a wider top. So treatment for uterine fibroids can vary depending on the size, number of them, and the location of the fibroids, as well as what symptoms they're causing. So if you aren't experiencing any symptoms from the fibroids, you may not need any treatments. So small fibroids can often be sort of left alone. Some people never experience any symptoms, as I mentioned, or have any problem associated with it. In these cases, the doctor may recommend monitoring the fibroids with pelvic exams or ultrasound. When it comes to treatments, conventional treatments often prescribe pain meds, iron supplements if the person sort of becomes anemic, birth control pills, GnRH medications to shrink the fibroids, but these are temporary solutions. There are several factors to consider when talking about the different types of surgery for fibroid removal. Not only can the size, location, and the number of fibroids influence the type of surgery, but your wishes for future pregnancies can also be important factor, basically, when developing a treatment plan. Some surgical options preserve the uterus to allow pregnancy in the future, while other options can either damage or remove the uterus. Myomectomy, for example, is a procedure that allows them to remove the fibroids, and there are several types of myomectomy. The type of procedure that may work best for you will depend on, again, where the fibroids are, where are they located, how big they are, how many you have, and the types of myomectomy procedure to remove the fibroids are different as well. For example, we have hysteroscopy, which your doctor uses the scope to cut away and remove the fibroid. There is laparoscopy, and your doctor will use a scope to remove the fibroids. Unlike hysteroscopy, this procedure involves placing a new small incision in your abdomen. This is how the scope will enter and exit the body, basically. Then there is laparotomy, which is during this procedure, your doctor makes one larger incision in the abdomen and removes the fibroids through this one cut. Of course, if you're not planning any future pregnancies, then they might perform hysterectomy, which is the removal of uterus. Then we have uterine fibroid embolization, which they put a small catheter in the uterine artery or radial artery and inject small particles, which then it will block the flow of blood from the artery to the fibroid. So loss of blood flow shrinks the fibroid and improves the symptoms. This procedure may not be right for everyone, though. Then there is radiofrequency ablation, or RFA, and this is safe and effective. This is a safe and effective treatment that uses microwave or RF energy to treat uterine fibroids. It's recommended for people who haven't reached menopause. It treats smaller fibroids, though. Not too long ago, the University of Mississippi Medical Center was working on heat therapy, where by applying direct heat energy, they could shrink and dry the fibroids. But I'm unsure where they are with it right now, or even if it's being practiced. On the alternative side of healing, avoid foods that make fibroids worse, such as high-fat processed meats, because these meats are some of the worst food choices for women when it comes to fibroids. Foods high in unhealthy fats, like non-organic processed meats or trans fats like think hamburgers and sausages and breakfast sausages can increase inflammation levels. Processed foods often contain chemical additives and other ingredients that promote inflammation. Limit the amount of meat you eat by also including sort of plant-based protein in your diet. If you must eat beef, always try to sort of opt for grass-fed. Non-organic dairy can also be high in steroids, hormones, and other chemicals that may alter your hormone levels, which encourages the development and growth of fibroids. Consuming a lot of refined sugars can promote inflammation and lead to weight gain. It may also increase pain and reduce immune function. There is an association between weight gain and hormonal imbalance, and these two factors can encourage the development of fibroids. So managing hormones not only involves the elimination of sugars from diet, but also refined carbohydrates. These are products that are made with white bleached flour, causing insulin levels to spike and hormones to become out of whack. Consuming processed grains like those of instant hot cereals and commercial breads, which cause a sharp rise in insulin. These refined carbohydrates have been sort of stripped of everything but starch. So they offer mostly empty calories and very little nutritional value. Over-consuming alcohol can definitely contribute to increased inflammation throughout the whole body. It also reduces immune function. It can promote weight gain, and it encourages hormonal imbalance. Too much caffeine is taxing on the body, especially the liver. When you give your liver more work to do than it can handle, it isn't going to do as good as a job at keeping your hormones in check. The more you can keep your alcohol and caffeine consumption down, the easier it is for your liver to detoxify your body and keep your hormones in proper fibroid discouraging balance, so to speak. Eat foods that help relieve fibroids. Here are some of the suggestions, for example, I may have to that you might need to include in your diet. Eating mostly organic foods may help to prevent and shrink fibroids because organic products are grown and made without the use of chemical pesticides. Now, pesticides used in commercial non-organic agriculture may impact estrogen levels and other hormones. Since hormonal balance is key to natural fibroid treatment, you want to reduce your pesticide intake as much as possible. Green leafy vegetables, these have many anti-inflammatory effects, so they may discourage the growth of fibroids in women's bodies. And these vegetables are also known as vitamin K rich foods, which aid in blood clotting and help control menstrual bleeding. Cruciferous vegetables support detoxification of the liver and may help balance estrogen levels. High consumption of, let's say, cauliflower, Brussels sprouts, cabbage, Chinese cabbage, tomato, and apple seems to be a protective factor for uterine fibroids, potentially due to their high antioxidant and fiber content. Plant-based diet, including greater intake of cruciferous vegetables and fresh fruits, is capable of reducing the incidence of uterine fibroid in ladies. Then there are beta-carotene-rich foods. Once digested, the human body turns beta-carotene into vitamin A, which promotes the growth and repair of healthy tissues. And in turn, it can be very helpful for treating fibroids. Some foods that are high in beta-carotene include things like carrots, sweet potatoes, kale, spinach, and so on. Fibroids sometimes cause some women to lose more blood during their monthly menstruation. This can lead to anemia. And to replace the excessive loss of iron due to increased bleeding, include high iron foods like grass-fed beef or legumes in your diet. Then there's flax seeds. They can help balance estrogen levels in the body, which can in turn work to shrink fibroids. You should aim for at least 2 tablespoons per day if you already have fibroids. You can sprinkle flaxseed on oatmeal in your smoothies or simply eat the seeds by themselves. I have done a clip on seed cycling, which may be worth viewing. Always ground the flaxseed for better absorption and keep it in the fridge. Instead of eating refined grains, opt for healthier whole grains like millet, spelt, brown rice, buckwheat, rye, and oats. These are higher in fiber, contain more minerals, and tend to be much less processed. Try supplements that aid in fibroid reduction. These are highly individualized, of course, based on your body's needs, but in general, they would be something like Vitex, or chasteberry, 400 milligram twice a day. This reduces estrogen levels by promoting the production of progesterone, and for best results, Vitex should be taken for at least 6 months. Fish oil, 1000 milligram a day, or flaxseed oil, 1 tablespoon daily. This can help reduce inflammation in the body, which plays a part in fibroid growth. B complex, 50 or 100 milligrams daily. And if B vitamins are lacking in the diet, the liver is missing some of the raw materials that it needs to carry out its metabolic process and regulate estrogen levels. Progesterone cream, 1/4 teaspoon, day 6 to 26 of your cycle. Applying progesterone cream topically sort of can help balance out low progesterone. When treating fibroids, it's important to work with a doctor who has tested your hormone levels, so you can be best advised if natural progesterone cream is the right option for your body or not. Milk thistle, 150 milligrams twice a day, aids body in liver detoxification, which can balance hormones. From a metaphysical perspective, uterine fibroids can be sort of understood as a physical manifestation of underlying emotional imbalances, particularly those related to anger, frustration, and feelings of being out of control. They can also reflect challenges in expressing oneself or navigating relationships, especially those with a strong sense of masculine energy, as well as fear and insecurity. Hope this has been helpful. Like and follow for more. Be the light.